Good evening and welcome to tonight's public hearing. This hearing will include Columbus City Council's Health and Human Services, Finance, and Workforce Development Committees. I am Council Member President Pro Tem Priscilla Tyson, and I chair these committees. Before we begin, please be aware that this hearing is being recorded for rebroadcast on CTV, Columbus Government Television Channel 3. The rebroadcast schedule is available at www.columbus.gov. Tonight's hearing is one in a series of bi-weekly committee hearings that I hold in order to review legislation in the committees that I chair. This includes Health and Human Services, Finance, and Workforce Development Committees. The goal of these hearings is to promote transparency and provide an opportunity for city residents to learn and to speak on legislation that impacts their lives. There will be on occasions when a committee is not covered because legislation is not always scheduled for each committee. The intent of each hearing is to review legislation that will be on the City Council's agenda for the following 2 weeks. Tonight, we will hear information on legislation in Health and Human Services and the Finance Committees. The legislation covered will be on City Council's agenda either March 21st or March 28th. We have 2 agenda speakers: the Department of Finance and Management Fiscal Manager, Christopher Long, and Columbus Public Health Assistant Health Commissioner, Nancy Bechtel. I will begin with legislation in the Finance Committee by asking Chris Long to present. Good evening.
Good evening, President Pro Tem Tyson. Our first ordinance is Ordinance 0565-2016, and this is seeking authority for the Finance and Management Director to establish purchase orders for ultra-low sulfur diesel and biodiesel fuel on behalf of our Fleet Management Division. And these purchase orders would be established from a previously established universal term contract that was negotiated by our purchasing office. It's a fairly standard request. It's something that we do each year, and it allows our Fleet Management Division to then fuel city vehicles.
This legislation is for $1.5 million.
That is correct.
All right, thank you.
Our next ordinance is Ordinance 0568-2016. This is very similar to our previous ordinance. This authorizes the Finance and Management Director to issue purchase orders for essentially unleaded fuel. Once again, from previously established universal term contracts negotiated through our purchasing office. And once again, this will allow our Fleet Management Division to fuel city vehicles.
Thank you, and this is for $3 million?
Correct.
And the Fleet Management spent $4,062,734.45 in unleaded fuels in 2015 from bulk deliveries and credit card services. And we anticipate spending the same amount?
We do. I mean, fuel prices are obviously volatile, so we look at that at each quarterly review, and if we find that, fuel prices are going up or down, we would certainly brief your office and council accordingly. But right now, we're thinking more or less they should be the same.
All right. Thank you.
Our next ordinance is 0664-2016. This is seeking authority to modify an existing universal term contract with Grainger for protective footwear. Essentially, it's asking for a 4-month extension until July 31st to allow our purchasing office time to rebid the contract. Essentially, a lot has changed in the last 3 years since the original universal term contract was negotiated, and purchasing is reaching out to all our city departments. They're working through human resources for safety issues. So the specs have become more complex and lengthier. So they're asking just for a few more months to put a comprehensive spec together and get it bid out and established before July 31st.
That's fine. Thanks for that explanation. I think that hopefully my colleagues will be, with that explanation, be willing to expand this additional 4 months. So thank you.
Thank you. Our next ordinance is Ordinance 0698-2016. This is seeking authority for the Department of Finance and Management to enter into a contract with Experience Columbus for the purpose of advocating and supporting what will hopefully be future RNC, Republican National Convention, or Democratic National Convention being held in Columbus. And we're asking for authority for $15,000 to be used for various functions in support of seeking a future convention.
And so, and maybe you'll be able to answer this question. Maybe if you cannot, then maybe we can get additional information. I know that we just passed legislation yesterday for over $9 million for Experience Columbus. And so would this not be similar work to the $9 million that we just passed yesterday?
The way I understand it is that the $9 million is for general promotional activities on behalf of the City of Columbus, whereas the $15,000 is specifically for RNC and DNC advocacy. And because it's also going to be pooled with other public and private partners like Franklin County, their request was that we set aside the $15,000 as a separate program that would be leveraged with what's hopefully will be other public and private dollars. And so to keep the two funds separate, sort of a general City of Columbus fund and then a RNC, DNC specific fund.
Thank you. And then the partners would be, of course, the City of Columbus, Franklin County, and the Columbus Partnership are all going to be supporting this endeavor for both of the conventions. Is that correct?
That is correct.
Okay. Thank you.
Thank you. Our next ordinance is Ordinance 0696-2016, and this seeks council authority for our Director of Finance and Management to enter into a contract with MSA Architects for $336,400. And this would be for the purpose of establishing a new professional architectural and engineering services task order basis contract. And essentially, as I understand what that is it allows our construction management team to engage one architect, in this case MSA Architects, to do general architectural design work on behalf of various city departments, finance, public safety, building and zoning services. And they went through a formal RFP process where numerous vendors submitted their proposals, and MSA was graded as having the best response.
Okay, so 12 organizations also submitted, excuse me, 12 organizations submitted documents for this particular, for this bid.
That is correct.
And this is, an MSA would be the recipients of up to $336,400. And some of the things, as you mentioned, would be for architectural design, construction administration for each project, structural, mechanical, electrical, and civil engineering, and obviously in other areas around for a project. Okay.
Our next ordinance is 0697-2016, which is very similar to our previous ordinance. This is seeking authority for our Director of Finance and Management to enter into contract with Roger D. Fields Associates in an amount up to $75,000 for professional engineering services on a task order basis. It's very similar to the previous ordinance, except professional engineering services are more for the internal mechanics of a building. So whereas an architectural firm like MSA would be engaged to sort of design the exterior of a building, the look, the style, and the spacing, Roger Fields would be concerned with if we need to design HVAC systems or electrical systems or plumbing systems, they would be engaged to help with those types of design functions.
Thank you. And so, and this would be for an amount up to $75,000.
That's correct.
All right. Thank you. And there were 8 other proposals that were submitted, correct?
Correct.
Okay. Thank you.
Our next ordinance is 0709-2016. This seeks authority for the Department of Building and Zoning through the Finance Management Director to establish purchase orders for the purchase of 10 small SUV vehicles from Buyers Ford within a previously established universal term contract. They would be using funds available within the Development Services Fund, and these purchases have been vetted through and approved by our Fleet Management Division as being necessary, and would result in essentially 10 of Development's existing vehicles that are past their useful life to be retired.
Thank you. And so the total cost is, you said, $222,000.
That's correct.
Thank you, for 10 vehicles.
Yes.
Correct. Thank you.
Our next ordinance is 0713-2016, and this seeks authority for our Finance and Management Director to issue purchase orders on behalf of the Fleet Management Division with Enterprise Holdings, essentially to rent vehicles on behalf, largely on behalf of our Division of Police and our Recreation and Parks Department. And we're seeking authority to rent these vehicles from an established state term contract. And the vehicles for Recreation and Parks would really be cargo vans used for their summer programs. And the rental vehicles for the Division of Police would be used for covert vehicle operations.
Thank you. And certainly we want to make sure that we have vehicles that will allow our children and adults to utilize the summer programs and not have transportation be the obstacle for them to move, to be able to be involved in some of the wonderful programs that we have in our Recreation and Parks Department. And certainly in regards to safety, we want to make sure that the police have the vehicles to be able to continue to make this a safe city. So thank you so much. And this is for about $50,000. Is that correct?
That's correct.
Thank you.
Our next ordinance is 0749-2016. This seeks authority for the Finance and Management Director to modify an existing contract through our Office of Construction Management with Gutnick Construction Company for renovation of our garage deck here at City Hall. There was a previous ordinance that council passed in 2015 that authorized $75,000 worth of roof renovations to our garage deck. And what we have found essentially is that wasn't adequate to fix all the leaks and cracks. And so this legislation seeks the authority to modify that same contract with Gutnick and to spend an additional $5,000 to finish that project.
Thank you.
0752-2016 is next. This is seeking authority for the Finance and Management Director to modify an existing contract with Palmetto Construction to finish up renovation of our 1120 Morris Road location, which is the site of Police Substation 18. We seek council authority, and council granted us authority to begin renovation on this project back in 2014. And essentially, there's a little bit more work that needs to be done on its sanitary drainage system that wasn't contemplated initially. And so this seeks authority to modify our existing construction contract to complete that work.
Thank you. Let me ask you a question. So on all these like contracts and renovations, do most of them have like a contingency amount put in? And so this is above and beyond the contingency?
That's correct, yes.
Okay, thank you.
0752, oh, excuse me, we just went through that one. My apologies. Our next ordinance is 0778-2016. And this is seeking authority for the Finance Management Director to modify and extend contracts on behalf of our Facilities Management Division with a series of vendors. These are essentially everyday contractors, I would say, that our facilities management division utilizes to perform preventive maintenance and standard repair and replacement of city buildings. The reason they're requesting the ability to extend those contracts for 4 additional months until July 31st is to allow them to rebid these services. They're all formally bid. These vendors have all agreed to hold their formal bid pricing, but many of these contracts are 3 years old now, and it's sort of similar to the footwear protection ordinance that we saw earlier, where our facilities management division wants to rebid these, and it's going to take them time to rework the specifications and put them out to bid, and they don't believe they'll be able to get that done before these contracts expire at the end of March and April. So they are respectfully requesting council's authority to allow them a little bit more time.
And so there are 9 different organizations that we want to extend their contract for 4 more months, and which will be and the modifications that cost us $52,500. And so I do appreciate, that on one hand, the 4 months that you need to be able to, for the facilities management, to be able to put the specifications together to bid the contracts. But I also just the question is, you have 8 of them, 2, 4, 6, 1, 2, 3, 4, 5, 6, 7, 8, 9 of them. And so my question would be that we anticipated we were going to have to rebid these. And so is there something that was happening within finance and management that we didn't bid this out sooner? Can you just kind of share that with me?
Sure. It's a couple of things, really. One is the fact that all of these have come due at the same time. And so I know the facilities management wants to stagger these going forward, so there's not a huge buildup of rebids that need to happen all at the same time. Because all of these contracts are expiring at the same time, they approached year end last year with not having had the time to rebid them. Then we got into a year end where we had our system closed down naturally for year end processes, and they couldn't bid. And now that we've got into the new year, they're finishing up the specs to get them back out on the street and rebid them. So it's kind of a function of probably having too many contracts expiring at the same time. And so I know their intent is when they rebid these to have staggered end dates so it doesn't hit them all at the same time, essentially.
Well, great. I'm excited that you're going to have staggered dates. I think that helps because you don't want to kind of overwork the individuals in the department that are doing this work. And we also don't want to modify those contracts if we don't have to. So I appreciate that you and the leadership of the finance department will be looking at staggering those bids. Thank you.
Thank you. Our final ordinance is Ordinance 0780-2016. This seeks council authority for the Finance and Management Director to modify and extend an existing contract with the Continental Office Furniture for flooring needs under the purview of Facilities Management. This was a formally bid contract, and it was bid to allow for 4 annual renewals. This is the 4th of those 4 annual renewals, so they'll have to rebid this, obviously. So this is just seeking the authority to renew it and to fund it for this year, and it would be for routine carpeting and flooring needs for facilities that they monitor.
So again, we were extended another year?
Yes, this would extend it for its last year, and then they would work this year, obviously, to rebid it for next year.
Great. And this is for $70,000?
Correct.
For the flooring needs of any of our city facilities?
That's correct.
All right. Okay. Thank you so much.
Thank you, President Pro Tem Tyson.
All right. Thank you, Mr. Long. And we'll now transition to Health and Human Services. And again, our Assistant Health Commissioner, Nancy Bechtel, will provide us with information regarding her upcoming legislation from Public Health.
Good evening, Councilwoman Tyson.
Good evening.
So we have 17 pieces of legislation tonight, so I will move through them. The first is ordinance number 0490-2016, and this ordinance is needed to accept and appropriate $720,000 in grant money from the Ohio Department of Health and fee revenues to fund our reproductive health and wellness program at the Health Department for the period April 1st, 2016 through March 31st, 2017. Our reproductive health and wellness program allows for comprehensive women's health services, including family planning, and we serve both pregnant and non-pregnant women under this program.
It says $720,000. Do you know how many people we served last year? Did we get this grant had this last year?
I don't know off the top of my head. Okay. I can get you that information.
That'd be excellent. Thank you.
Mm-hmm. It's in the thousands. I believe it's in the thousands. So, all right. The next ordinance is number 0575-2016, and we've been awarded a grant from the Public Health Institute through the Kresge Foundation for the 2016 Climate Change, Health, and Equity Grant Program. So this ordinance is needed for us to accept and appropriate $30,000 in grant monies for this program for the period of January 1st, 2016 through June 30th, 2017. The Climate Change, Health, and Equity Grant Program is designed to provide climate change education to faith communities in Columbus, Ohio. The goal of this project is to use climate change information to secure commitments from both faith-based institutions and their congregation members to engage in climate change adaptation and mitigation actions by those members. The next ordinance is ordinance number 0577-2016, and this is for a grant that we've been awarded from Medical Mutual of Ohio Charitable Fund through the Columbus Foundation that will go to our Institute of Active Living program. This ordinance is needed to accept and appropriate $45,000 in grant monies for the period of January 1st, 2016 through October 31st, 2016. Columbus Public Health Institute for Active Living program seeks to promote active lifestyles and improve the health of all citizens in the city of Columbus. This grant will be utilized to create new youth cycling clubs, to develop small gardens at early child care centers, and to support and expand the Veggie Snaps program, which is the farmers market nutrition incentive program that we help run.
Great. That's it. I know $45,000 doesn't seem like a lot of money, but it certainly is in regards to starting this new cycling clubs for children. That certainly will help with our childhood obesity, and the small gardens for early childhood centers, so those kids will be able to start learning how to grow fruits and vegetables. That will be really exciting, and they'll be eating more healthy, and then of course the SNAPS program. So this is great. It's exciting.
Hopefully it develops lifelong patterns of them having gardens and eating healthy produce and cycling and being interested in those events.
Thank you.
The next ordinance is 0608-2016, and this is for our electronic medical record. Will authorize our Board of Health to enter into an agreement with NextGen Healthcare Information Systems, LLC, which is our electronic medical record at the Health Department, for us to be able to do new 2016 medical billing codes, add additional user licenses, and to have improved screening capabilities for our medical record system in an amount of $32,812.77. Our NextGen system enables us to operate 5 major clinics at the health departments, which provide an extensive array of services for episodic care. The software will enable us to do patient registration, appointment scheduling, monitoring and tracking of patient test results, create and process electronic medical records, and generate reports to help manage clinic operations. The next 6 ordinances that are here tonight all have to do with funding that we've received from Ryan White Part A HIV Emergency Relief Grant Program from the U.S. Department of Health and Human Services, the Health Resources and Services Administration. So the first one is ordinance number 0648-2016, and this grant requires us to assure quality medical care to eligible persons living with HIV or AIDS in Central Ohio, and it's bigger than just Columbus. It includes Franklin County, Licking County, Delaware, Morrow, Union, Madison, Pickaway, and Fairfield counties. So this ordinance will allow the Board of Health to contract with OSU Internal Medicine, LLC, to provide HIV-related medical care services in the amount of $240,000 for the contract period of March 1st, 2016 through February 28th, 2017. The next one is ordinance number 0650-2016, and this grant will allow Columbus Public Health to assure quality medical care to eligible persons living with HIV or AIDS, again, in those counties, Franklin, Licking, Delaware, Morrow, Union, Madison, Pickaway, and Fairfield. And it will allow our Board of Health to contract with the AIDS Resource Center, Ohio, to provide HIV-related medical care and medical case management services in the amount of $764,713 for a contract period of March 1st, 2016 through February 28th, 2017.
Nancy, as you, and certainly I don't know if you have the numbers today, but certainly I know that this isn't the first year we're getting Ryan White money. We've been getting it ongoing because of just the high numbers of individuals in our community that have HIV and AIDS. So I know when it's time for the hearing, I would love to have the numbers that what we've done in the past to how this grant has supported our community in these areas.
I will certainly get those for you.
Thank you.
The next ordinance that has to do with this same Ryan White grant is ordinance number 0651-2016. And again, this is for us to assure quality medical care to eligible persons living with HIV or AIDS in those same Central Ohio counties, and for us to contract with nationwide children's hospitals to provide HIV-related medical care and medical case management services for pediatric clients with HIV or AIDS in the amount of $361,548 for the contract period of March 1st, 2016 through February 28th, 2017. The next one is ordinance number 0652-2016, and this allows us to assure quality medical care to eligible clients with HIV in those same counties for us to contract with the AIDS Healthcare Foundation to provide medical care and medical case management in the amount of $183,889 for the contract period March 1st, 2016 through February 28th, 2017. So the next ordinance is 0653-2016. So again, through the Ryan White Part A grant, funds are available for behavioral health services as well for persons living with HIV or AIDS in the same counties, Delaware, Fairfield, Franklin, Licking, Madison, Morrow, Pickaway, and Union. So this ordinance will allow our Board of Health to contract with AIDS Resource Center, Ohio, to provide behavioral health services for people living with HIV or AIDS for the period of March 1st, 2016 through February 28th, 2017 in the amount of $259,568.
And again, we'll want numbers on those as well as the type of behavioral services that they're providing.
Okay,
Thank you.
certainly. The next one is, again, with Nationwide Children's Hospital for behavioral health services for persons living with HIV or AIDS in those same counties in the amount of $104,742 for behavioral health services for the period of March 1st, 2016 through February 28th, 2017. Okay, the next ordinance is not the Ryan White's. It's 0658-2016. So we've been awarded a grant from the U.S. Department of Housing and Urban Development, or HUD, for 2016 housing opportunities for persons with AIDS, which is the HOPWA grant program, in the amount of $859,524. This ordinance will allow the initial appropriation of $500,000 in grant monies for the 26 HOPWA grant, and then it authorizes a supplemental appropriation of $359,524 from the unappropriated balance of the General Government Grants Fund for the 2016 HOPWA grant. So this grant is for the period of January 1st, 2016 through December 31st, 2016. The HOPWA program provides for the implementation of long-term comprehensive strategies for meeting the housing needs of low-income persons with HIV or AIDS and their families. Eligible activities including providing housing information services, resource identification, acquisition, rehabilitation, conversion, lease, and repair of facilities to provide housing and services, some new construction of housing units, project or tenant-based rental assistance, short-term rent, mortgage and utility payments, supportive services, technical assistance, and/or administrative support.
Nancy, so the HOPWA program, so if individuals are seeking to get any of those services, how would they do that?
So they could call our Ryan White program at the health department to try and get those services.
Okay. Thank you.
You're welcome. And all our contact information can be found on our website. Okay, the next ordinance is 0616-2016, and this ordinance authorizes our Board of Health to enter into a competitively bid contract with KNS Services Incorporated for video monitoring equipment maintenance for the period of June 1st, 2016 through May 31st, 2017 in the amount of $28,500. Columbus Public Health needs this maintenance services for its CCTV and call for assistance units, to maintain the interface between CCTV system, the call for assistance system, our matrix system, our card access system, and to maintain and service all our electronic locking devices and panic buttons associated with matrix systems, card access equipment, etc., at our 240 Parsons Avenue facility. So the solicitation for this ordinance was number SA005911 for CCTV maintenance and preventive maintenance services, and was posted June 15th through June 19th, 2015. All vendors registered with the City of Columbus under Commodity Code 93984 and were solicited for bids. KNS Services Incorporated was awarded the contract with a bid of $2,375 per month or $28,500 per year. And this is the second year of the 5-year bid contract.
Thank you.
Okay, the next ordinance is 0489-2016. So the Board of Health has a need to contract with a medical director services from Columbus Neighborhood Health Center, Inc., which is doing business as Primary One Health. This contract will provide physician services for our Women's Health and Family Planning Clinic at the Health Department. Services to be provided include oversight for medical functions of the clinic, gynecologic exams, contraceptive services, and screening and treatment of sexually transmitted infections, and also providing on-call services for patients of our Women's Health and Family Planning Clinic. Formal bids were not solicited, therefore this ordinance waives competitive bidding provisions. The ordinance authorizes our Board of Health to enter into a contract with Columbus Neighborhood Health Center, Inc., DBA Primary One Health, for medical director services for our Women's Health and Family Planning Clinic for the period of April 1st, 2016 through March 31st, 2017 in the amount of $30,000 from the Health Special Revenue Fund.
And can you please share why we are waiving competitive bidding?
Because of our contractual arrangement with Primary One Health that we have as the city for services, and they have been our medical director over the clinic with our advanced practice nurses.
Thank you.
Okay, the next one is ordinance number 0659-2016, which is to provide social support services through contract with Southeast Inc. So again, through the Ryan White Part A grant, funds are available for social support services for persons with HIV or AIDS. This ordinance authorizes the Board of Health to enter into contract in the amount of $510,933 with Southeast Inc. for the provision of housing services, case management, and emergency financial assistance for people with HIV or AIDS in the same counties, Delaware, Fairfield, Franklin, Licking, Madison, Morrow, Pickaway, and Union, for the contract period of March 1st, 2016 through February 28th, 2017. Ordinance number 0687-2016 is needed and will authorize the Director of Finance and Management to establish a purchase order with Capital Wholesale Drug Company in an amount not to exceed $155,000 for the purchase of pharmaceuticals that Columbus Public Health's tuberculosis and immunizations program needs. Columbus Public Health has a need to purchase these pharmaceuticals in order to maintain our patient care services. The pharmaceuticals needed are not currently available through the city's catalogs, and there is an immediate need to purchase the pharmaceuticals due to a diminishing stock on hand. A waiver of regulations is being considered to waive relevant provisions of the Columbus City Code relating to the competitive bidding process in order to award a purchase order to Capital Wholesale Drug Company. Any questions on that one?
So it says that a waiver of regulations is being submitted to waive relevant provisions of the Columbus City Code. And so why are we having to use Capital Wholesale Drug Inc. as opposed to any other?
They've been providing the medications for us, and as I understand it, our stock is running so low that it's an emergency kind of extension in order to get us medications that we need in the short term.
Okay. And so this is to extend the current contract?
Yes, that's what I understand.
And this will be for $155,000 for the entire year, or is it for, if it's for a period of time?
That's a good question. It's not on here.
Okay. Well, you can find out and let us
Okay,
know.
I will.
And then will we be looking at bidding it out next year, or well, you can let me know all that.
Yes, so, it's the formularies that the drug companies have is how we would determine who could provide what drugs and what bids we would put out. I will get that time frame for you, though. I'm not sure why it's not here. Okay, the next one is a contract for lab services with Ohio State University Hospital, and it's ordinance number 0727-2016. And this is for us to contract, again, under the Ryan White Part A HIV care program for laboratory testing and diagnostic services with the Ohio State University labs in order to assure quality medical care to eligible persons living with HIV or AIDS in Central Ohio. This lab with the Ohio State University Hospital contract will be for $81,734, and it will be for the period of March 1st, 2016 through February 28, 2017. Okay, our last ordinance for tonight is ordinance number 0579-2016, and it's needed to modify, increase, and extend contract number ED 053773 with Confluence Unlimited for an additional 8 months of services in the amount of $3,100 for a total contract amount not to exceed $11,335 through the time period ending December 31st, 2016. This modification is needed to provide continued design and facilitation of 4 additional stakeholder meetings for the Chronic Disease Prevention Advisory Board and its subcommittees. And Confluence Unlimited has been working with this advisory board and subcommittees on initiatives that are addressing chronic disease prevention and healthy eating.
Thank you. And will we facilitation of the stakeholder meetings, and once 4 additional stakeholder meetings are completed, will we be getting a report back regarding chronic disease prevention from the advisory board?
Yes, I know that they're working, they've been doing regular documentation, and they are working on various reports from these groups.
All right, thank you. Well, I hope this evening's hearing has provided insight into the programs and community initiatives from Columbus Public Health, as well as finance-related legislation that is necessary to support our ongoing city operations. As a resident, these hearings are an opportunity for you to learn and become engaged in issues that are presented. The next bi-weekly hearing will be held on March the 29th at 5 p.m. I will also hold a hearing tomorrow at 3:30 in which social service agencies receiving grant funding from the city will provide an update on their programs. Before I conclude tonight's hearing, I want to thank Chris Long from the Finance Department and Nancy Bechtel from Columbus Public Health, also my fellow council members and their staffs who serve our community with pride every day. I also want to thank City Council's Legislative Research Office, especially Michael Kassler, who leads the Legislative Research Team, and Andrew Dwyer, who staffs Health and Human Services and the Workforce Development Committees, and Matt Erickson, who staffs the Finance Committee. I also want to thank my staff, Nicole Harper and Carl Williams, and then also the hardworking team of CTV who make these hearings possible to provide information to the residents. And finally, the residents of Columbus who make our city the best place in the country to live, work, and to raise a family. And tonight, if you haven't already done so, please go out and make your voice heard by voting. Thank you very much. This hearing is adjourned.